Have you experienced numbness, tingling, or weakness in your hand that worsens with repetitive movements? But what causes this condition? Who is at risk? And how can it be prevented or managed? Good day, everyone. We are the Group 6, and this report explores the key aspects of carpal tunnel syndrome, including its definition, causes, risk factors, and implications for health and productivity. Members of the Group 6 are Makiran Christian Andrew, Pedrola Eliza Pearl, Peñol Kiana Jan Liv, Kidato Jan Lar, Salcedo Mary Colleen Faith, and Samaniego Wayne Rook. Now for our definition and etiology of carpal tunnel syndrome. So, carpal tunnel syndrome is when the median nerve is compressed as it passes through the carpal tunnel. The carpal tunnel is a space created by the natural arc of the wrist bones. A thick band called the transverse carpal ligament creates a roof to the tunnel. This means that the size of the tunnel cannot change, as the bones and ligaments act like solid walls. Nine tendons that bend the fingers and thumb and the median nerve pass through the tunnel. The median nerve provides feeling, sensation to the skin of the thumb, index, and middle fingers, as well as half of the ring finger. The nerve also provides a communication line to the muscles at the base of the thumb, the thinner muscles. If it gets compressed or irritated, you may have symptoms. So, for our etiology or the causes of the syndrome, we have excess pressure in the wrist and median nerve, rheumatoid arthritis, gout, amyloidosis, infections, psoriatic arthritis, arthritic spurs of the carpal bones, tumors, ganglion cysts, wrist fracture or dislocation of the wrist, and repetitive motions performed at work or at home. And for our risk factors, we have women, because due to a smaller carpal tunnel space, ages of 30 to 60, obesity, and has medical conditions like diabetes, hypothyroidism, rheumatoid arthritis, and kidney failure. Also, jobs requiring prolonged or forceful hand use, like manufacturing, assembly line work, keyboarding, occupations, and construction works.
In this portion, we will be proceeding with the pathophysiology for carpal tunnel syndrome. Here we have the risk factors for carpal tunnel syndrome. We first have the predisposing factors such as narrow carpal tunnel. It is more common in women, older adults, those with genetic risk, and during pregnancy due to fluid retention. Precipitating factors are triggered by repetitive wrist motions such as typing, poor ergonomics, obesity, diabetes, hypothyroidism, or rheumatoid arthritis. The pathophysiology usually begins with a flexor tendon overuse or systemic inflammation, which causes synovial swelling inside the tunnel. The rigid boundaries of the carpal tunnel cannot expand, so intratunnel pressure increases, intermittently compressing the median nerve. Early sensory complaints may involve occasional tingling or numbness in the thumb to radial half of the ring finger, triggered by activity and relieved by rest or shaking the hand. The next parts explain the nerve ischemia and intermittent demyelation of carpal tunnel syndrome. The space inside the carpal tunnel remains narrow due to chronic swelling, and because of this, pressure builds up and becomes sustained, especially during repetitive wrist motions, prolonged flexion or extension, or at night. The sustained pressure begins to compress the small blood vessels that supply the median nerve. This reduces oxygen and nutrient delivery, a state called ischemia. As we know, nerve cells such as neurons and Schwann cells are highly metabolically active, and this ischemia disrupts their function, leading to inflammation within the nerve and further aggravates the swelling. This produces mild hand discomfort or fatigue during repetitive use and occasional awkwardness with fine tasks. Moving on, the Schwann cells that produce myelin begin to suffer damage due to ischemic and inflammatory environment. Myelin is ripped off in segments, causing slower and less efficient conduction of nerve signals. This is the first true sign of nerve injury, and it's still potentially reversible at this point if pressure is relieved. Clinical manifestations would involve recurrent or persistent tingling, numbness, or even burning in median nerve distribution. Physical examination would reveal a Phelan's test, wrist reflection for 60 seconds reproduces tingling, as well as Tinel's sign. Tapping over the median nerve causes shock-like sensation. The Durkin's test or direct pressure over the carpal tunnel elicits symptoms. Diagnostics would involve nerve conduction study or NCS, which would reveal prolonged sensory latency. Carpal tunnel syndrome is officially diagnosed when first, median nerve compression causes persistent and recurrent symptoms. Second, symptoms affect daily function or sleep. And third, it is confirmed by nerve conduction study.
And now, let us proceed with the clinical manifestations. First, we have tingling and numbness or paresthesia. It is commonly felt in the thumb, index, middle and half of the ring finger, and it is often worse at night or upon waking. Next manifestation is pain, and it can radiate from the wrist up to the arm or down to the fingers. It may also worsen with activities involving wrist flexion or repetitive hand movements. The third manifestation is weakness. It involves difficulty gripping objects or performing fine motor tasks. It also involves dropping objects frequently due to loss of hand strength. The next one is clumsiness, or trouble with tasks that requires dexterity. For example, trouble in buttoning a shirt. We can also observe thinner muscle atrophy or wasting of the muscles at the base of the thumb in long-standing or severe cases. Positive Phelan's test, or tingling or numbness when the wrists are flexed and held together for 60 seconds, is also observed. The next manifestation is tingling or electric shock sensation when tapping over the median nerve at the wrist, which is known as the positive Tinel sign. Lastly, we have the positive Durkan's test, wherein tingling or numbness is triggered when the examiner presses firmly over the carpal tunnel for 30 to 60 seconds. It is often more sensitive than Tinel's or the Phelan's test.
Let's proceed to the medications and surgical interventions used in managing carpal tunnel syndrome. There are four medications indicated for relieving symptoms of carpal tunnel syndrome. First is ibuprofen. It is a nonsteroidal anti-inflammatory drug. It helps relieve mild to moderate pain and reduces inflammation around the median nerve. This medication is commonly used in the early stages to manage discomfort. Next is prednisone. It is an oral corticosteroid with systemic anti-inflammatory effects. It is prescribed to reduce inflammation and alleviate nerve pressure. It is usually taken for a short duration to manage acute symptoms. Another one is methylprednisolone. It is a corticosteroid used to decrease inflammation. It may be administered via injection directly into the carpal tunnel to provide localized relief. It helps reduce the swelling that compresses the median nerve. Lastly is gabapentin. It is an anticonvulsant medication that is also used to treat nerve pain. It is especially useful in patients who experience neuropathic symptoms like burning or tingling sensations. It works by altering the way nerves send messages to the brain, helping to control the pain. In cases where medications and conservative measures fail, the next step is surgery. Carpal tunnel release surgery is the gold standard treatment for moderate to severe cases of carpal tunnel syndrome, or when there is failure of conservative therapy. The goal is to relieve pressure on the median nerve by cutting the transverse carpal ligament. This surgery significantly improves symptoms and prevents further nerve damage. Next is endoscopic release. It is a minimally invasive alternative to the traditional open release. It uses a small camera and requires only tiny incisions. This method results in less postoperative pain and a quicker recovery compared to open surgery. Lastly is open carpal tunnel release. This is the traditional surgical technique. It is highly effective in relieving pressure on the median nerve by making a larger incision to access the ligament directly. While the recovery time may be slightly longer than the endoscopic surgery, it remains a reliable and commonly used method.
Moving on to our nursing diagnosis and management, where we have chosen five diagnoses and five interventions for each. First diagnosis is acute pain related to nerve compression in the carpal tunnel. For the management, we should assess pain level using a standardized pain scale. Encourage use of a wrist splint, especially at night, to immobilize the wrist and reduce nerve compression. Apply cold compress to reduce inflammation and numb pain. Administer prescribed NSAIDs or analgesics per doctor's order. And lastly, to educate the patient to avoid repetitive wrist movements and take frequent rest breaks during activities. Second is impaired physical mobility related to pain and limited wrist movement. For the management, assess range of motion and muscle strength in the affected hand and wrist. Encourage gentle range of motion exercises to maintain joint flexibility without worsening symptoms. Provide assistive devices as needed, like adaptive tools for self care or work tasks. Collaborate with occupational or physical therapy for hand strengthening activities. And monitor the patient's ability to perform activities of daily living safely and independently. Third, risk for peripheral neurovascular dysfunction related to nerve compression. For the management, we should monitor for signs of neurovascular compromise such as numbness, tingling, pallor, or decreased capillary refill. Perform regular assessments of sensation, motor function, and circulation in the affected limb. Teach the patient to report any worsening symptoms like increased numbness or weakness. Elevate the hand to minimize swelling if edema is present, and advise avoiding prolonged or extreme wrist flexion or extension positions. Fourth, disturbed sleep pattern related to nighttime pain and paresthesia. For the management, we should encourage use of wrist splints during sleep to maintain a neutral wrist position. Instruct the patient to avoid sleeping on their hands or wrists. Administer prescribed medications like NSAIDs or mild sedatives before bedtime if needed. Recommend relaxation techniques like deep breathing or meditation to improve sleep quality. And create a sleep conducive environment, which is a dark, quiet, and comfortable room. And lastly, deficient knowledge related to the condition and its management. Firstly, we should explain the pathophysiology, risk factors, and typical progression of carpal tunnel syndrome. Next is to teach ergonomic principles, such as maintaining neutral wrist posture during work or typing. Instruct on home care measures like the proper use of splints, hand exercises, and activity modification. Discuss potential treatment options, including medications, physical therapy, or surgical intervention. And lastly, to provide printed or digital educational materials for reference and reinforcement.
So for our health teaching, we have your health promotion and your prevention. So the use of your ergonomic tools and wrist support, such as your ergonomic keyboards, your mouse pads with your wrist rest, and your properly positioned tools will help maintain neutral wrist position and reduce the strain. The next is to take frequent breaks during repetitive tasks such as your typing or your assembly line work. This can compress the median nerve, so frequent breaks relieves pressure and reduces your culminative stress. Next is to avoid prolonged wrist flexion or extension. These extreme risk positions can increase the pressure in the carpal tunnel, so keeping wrist neutral helps minimizes this compression. The next is to maintain ideal weight, since obesity can increase the risk for your carpal tunnel syndrome due to fat deposits, and it increases your inflammation around the wrist, which can narrow the carpal tunnel. The next is to manage your chronic illnesses such as your diabetes and your hypothyroidism. Since this condition can contribute to the nerve damage and fluid retention, it can exacerbate your carpal tunnel syndrome. The next is hand and wrist strengthening exercises. This is controlled exercises that improve support and flexibility, aiding in prevention and recovery of your carpal tunnel syndrome. The next is our geriatric considerations. We have your age-related tissue stiffness. It increases your compression risk. And with age, ligaments and tendons become less flexible, making the carpal tunnel space more rigid and likely to compress the median nerve. The next is your core morbidities, such as your diabetes and your arthritis. It can complicate your symptoms. These diseases can increase the inflammation or nerve damage. It can worsen your carpal tunnel syndrome symptoms or delay diagnosis. The next is your delayed healing post surgery. So, since older patients typically heal more slowly, which can extend recovery time after carpal tunnel syndrome surgery. Next, we have your to ensure your adaptive devices to assist with activities of daily living. Tools like jar openers or button hooks help patients with weakened hand function to remain functioning. Next, we have to monitor for medication side effects, especially your NSAIDs, since older patients or older adults are more susceptible to gastrointestinal, kidney, or cardiovascular side effects from prolonged NSAIDs use. It is often used to manage pain. So that would be all for our health teaching. Thank you so much.